Hello and welcome to The Agenda. I'm Stephen Cole. Today, vaccine nationalism, questionable procurement schemes and broken promises. This is the fallout of a bitter dispute over vaccines between the EU and the UK. As the two trading partners attempt to find a solution, we're asking what part Brexit has played and why Anglo-Swedish vaccine manufacturer AstraZeneca has been caught in the crossfire. At the end of March, European Union leaders came close to banning vaccine exports to the UK. Instead, they called for more transparency from Britain on the number of doses they exported. This is just the latest chapter in a long and a grinding vaccine dispute. At the heart of it is the Anglo-Swedish vaccine manufacturer AstraZeneca, which the EU has accused of failing to deliver on vaccine promises.
Companies have to honour their contract to the European Union before they export to other regions in the world. And this is, of course, the case with AstraZeneca.
Initially, the bloc had expected to receive 300 million doses of the jab by the end of June. Now it looks likely to receive only about a third of that.
Und insofern sind wir auf der einen Seite daran orientiert.
We are inclined to respect global supply chains and want to fight protectionism. But of course, we also want to protect our own people because we know this is the way out of the crisis.
Some EU countries like Germany are facing major questions about the numbers vaccinated after failing to use the vaccines that were successfully delivered in February. Some believe the EU's scepticism about the AstraZeneca vaccine hasn't helped. In January, the French President Emmanuel Macron claimed it was quasi-ineffective for people over 65. By March, France was one of 13 countries which had banned the use of AstraZeneca over fears about blood clots, a concern the European Medicines Agency has since dismissed.
La décision qui a été prise en conformité aussi avec
The decision which has been taken, in conformity with our European policy, is to suspend, by precaution, vaccinating with the AstraZeneca vaccine.
Some EU states still have confidence in the bloc scheme, especially smaller countries who would otherwise struggle in the international scramble for vaccines. But critics of the European Commission's joint procurement scheme say it didn't bet big enough or early enough on the world's leading vaccines. The bloc only signed its contract for the Pfizer vaccine several months after the United States and Britain. The UK's capacity to fast-track these regulatory approvals has also raised questions over the dreaded B word, Brexit.
The partnership we have with our European colleagues is very, very important. We continue to work with them. Vaccines, as you know, are the product of international cooperation.
Since the UK left the EU in January, there's been a lot of debate about whether or not Brexit helped the UK to achieve a faster vaccine rollout. Could London have carried out a fast-track approval while it was still in the bloc, or would it have been under too much pressure to stay in line with the EU's procurement scheme? As ever with the EU-UK relationship, the answer isn't straightforward. Hoping to provide some clarity in this complicated dispute is our panel of guests, Editor-in-Chief of the online EU Politics magazine, Brussels Report, Pieter Cleppe, and virologist and oncology specialist at the University of Warwick, Professor Lawrence Young. Welcome to both of you. And I want to start with you, Professor Young, because coming up with a vaccine in such a short period of time is almost unheard of. This is a fantastic achievement, isn't it?
Yeah, it's an incredible achievement of essentially of modern science and demonstrates what you can do when there is an urgent need and when you collaborate across the world. So this has really been a truly international effort.
So you've had a successful collaboration around the world, and it's set a very high bar for future, if you like, collaborations for producing vaccines, hasn't it?
Yeah, I think this is going to change the face of the way that we do research, particularly infectious disease research and vaccine research, and has demonstrated how important it is that we do collaborate. And I think one of the legacies of this whole scenario, this whole pandemic, will be better international cooperation around infectious disease and vaccine development.
Scientifically, how would you describe the challenge?
I think the challenge is one where it's been difficult in the sense that one's had to hit the ground running, developing novel diagnostics, trying to understand more and more about the way the virus infects people and the way the body's immune system works, whilst also developing a vaccine. And I think once we have the luxury of time, we can get even cleverer in the way that we design vaccines. But it's for sure that the type of technology, particularly the technology around mRNA vaccines, has changed the face of the way that we treat disease, not only infectious disease, but cancer, probably forever.
And Pieter Cleppe, an amazing achievement, as you've just heard Professor Young talk about, in getting a vaccine so quickly. Then the politics kicked in. What went wrong?
Well, indeed, it's quite a contrast, isn't it? So scientists came up with, in no time, with a vaccine that few people would have hoped for, at least in such a short time. And then I think now we're nearing a situation of, I would say, vaccine protectionism, whereby not just in Europe, but also in places like India, there are more and more calls to sort of interrupt the global supply chains of vaccines. And of course, you don't have to be an expert to be able to understand that this is a grave danger. Many people are not yet vaccinated. Any delay costs life. It's as simple as that. Pfizer said that the component of their vaccines are coming from 18 different countries. So any attempt to delay, restrict, interrupt that process, if not with actual restrictions, but only with bureaucracy, costs life. And that's incredibly unfortunate, of course.
Well, Peter, Pfizer also said this week that EU export controls have become a burden for Pfizer, and they are criticising these border controls on their products, or making the products.
The President of the European Commission has made no attempt to hide that this is pointed at the UK, even if you would actually have restrictions on vaccines flowing from the EU to the UK. At best, the EU could only win 1 week, whereas the United Kingdom, its vaccination rollout could be delayed by 2 months. So this would be disastrous.
Professor Young, I saw you nodding there, and we started sort of very positively and optimistically about how much collaboration there had been. How much collaboration did it need to produce the vaccine? And Peter's talking about, different parts of the vaccine perhaps produced in different countries.
Yeah, I think there's 3 different aspects of this. One is the basic science that goes behind developing vaccines, and that's where there's been a lot of international collaboration, no question about that. The second part, obviously, which starts to get a little bit more difficult, I think, is the whole issue of manufacture. What this has highlighted is a worldwide deficiency in manufacturing capacity for these complex vaccines. They're not straightforward. They're biological entities and they're difficult to produce. And it's ridiculous that we have to rely on places like the Serum Institute in India, for instance. It's crazy that we just don't have and have not prepared ourselves to have the appropriate manufacturing facilities and indeed the supply of raw materials. And I think the third thing, which starts to obviously edge into what Peter's discussing around politics in a way, is the whole approach to procurement and contracting for vaccines. So in a way, this takes it away from the basic science that produced these wonderful vaccines. And remember, there are tens of companies, tens of different vaccines now being tested at different stages. That's been marvelous, but you can't do that if you don't have the manufacturing capacity and you don't have a robust approach to procurement. And I think that's where things are becoming increasingly challenging.
Do you think, Professor Young, this will change the way big pharma operates in future, in terms of creating their own world separate from politics?
I think it will create a different approach to the way that we think about manufacturing. I also think there's something really interesting in all of this. There are many, many lessons to learn. It's quite interesting, is it not, that the AstraZeneca Oxford vaccine is being produced at cost, and yet it's obviously suffering a lot. And a lot of these other vaccines obviously are making quite significant profits. There's nothing wrong with making a profit, but I think in the current situation, I think not only do the big pharma companies need to think about manufacturing, but also governments need to be concerned, I think, for the future about the preparedness for this type of event and what it means for the future rollout of vaccines, not only in their own countries, but the responsibility we all have to think about this in developing countries as well.
And I'll put that to Pieter in a moment, but before I go to Pieter, Professor Young, the UK has taken a very different approach to the EU in terms of prioritising the first dose. Has that paid off?
It has. I have to say, I was a little sceptical myself about that, actually, particularly as early data was coming in and we were unsure about the whole issue of the second dose. Very important, as we know, that it's always really important to get a booster dose. But now looking at the data as it's coming through, it's absolutely right that that was the correct approach. And what we've done also is prioritise, obviously, older folk for vaccination and protected the most vulnerable. And we can see that now in the UK with the significant, amazing fall in the number of cases, hospitalisations and deaths. It's been a remarkable effect in a relatively short period of time, actually.
Pieter Cleppe, how would you compare the rollouts of the EU and the UK?
Well, the figures speak for itself. The UK has been quicker to first approve the vaccine. This is a responsibility of the UK agency, not of politics. Now, the European Medicine Agency was slightly slower, but not that much slower, so I wouldn't really put the delays down to that. The root of the problem in the EU is that the European Commission has not been negotiating well with these big pharma companies. Israel, for example, pays 2.5 times the price that the EU pays for the Pfizer vaccine. So according to many analysts, this is one of the reasons why Israel has secured more vaccine. We can't be sure.
And was also one of the early successful countries, wasn't it?
Exactly. Of course, Israel has also permitted that some of the data related to its citizens being vaccinated is being shared with Pfizer. In Europe, perhaps people would not be happy with that. So, I mean, it's a complex story. Also, the EU has been accusing one of the vaccine producers, AstraZeneca, of violating its contract. Also, when lawyers looked at the contract, this was far from clear that this was the case. And despite the fact that the French government has been threatening to start legal action against the EU over this.
Thierry Breton, the EU's internal market chief, is saying 0 AstraZeneca jabs made on the continent would be shipped across the channel until the company, he says, fulfills its commitments to Europe. Could that be the right decision? I mean, it can't, can it?
Well, I think it's absolutely wrong, because this is a violation of contracts. The contract is not between the EU and AstraZeneca here that is being violated, but between the UK and AstraZeneca. So when the EU goes off to rip up contracts, I think it's not exactly, assuring the trust of future pharma investments in the bloc.
Exactly. And Professor Young, I mean, this kind of vaccine nationalism must have people like yourself, the medical experts, the scientific experts, pulling their hair out because they've worked so fast.
It is. It's a terrible thing. And the bottom line, and come back to what Pieter said, this is costing lives. And for us, what we've been doing is working really hard to get these vaccines out to save lives. And it's just really, really sad that politics is getting in the way of all this.
Can you give us some perspective? Because there were concerns from Germany and from France and from Spain about the use of AstraZeneca in causing blood clots. Was that a genuine reason to inhibit the use of the AstraZeneca vaccine?
Well, it's important that any adverse serious events associated with any medicine, including these vaccines, is investigated. It's quite clear that these clots are very, very, very rare, but they still need to be investigated. And what you have to do in your own country is compare the blood clots with the levels that you'd see in a normal unvaccinated population. And indeed, a recent report that came out in the last 24 hours from Denmark shows that there's no real increased risk of blood clotting associated with vaccination. When you're rolling out a vaccine across millions of people, sadly, some of these people will get other illnesses that are nothing to do with the vaccination, but they do need to be investigated. The question is it appropriate to pause life-saving vaccination when you have a very rare event, or should you continue? I'll give you one piece of information about that, which is if you vaccinate 1 million people in looking at the German data alone, you'd expect 12 to have a blood clots and perhaps 4 of them to die. But if the same population get infected with COVID, then out of 1 million people, 20,000 would die. So I think what the issue is here is getting some perspective, recognizing, of course, that you must investigate serious adverse events, but pausing vaccination on that basis is a very dangerous thing to do because more people will die.
Professor Young and Pieter Cleppe, thank you both for the moment. We're going to take a break, but join us afterwards where we'll be speaking to a trade expert about vaccine nationalism and, of course, the B word, Brexit. Mari, what would you say is a good question?
Stephen, I'd say it's one where there's always more than one answer.
The Answers Project is a new podcast series from CGTN Europe. With me, Stephen Cole.
And me, Mari Beveridge. In each episode, we'll take a complex question.
And with the help of some of the world's foremost experts, shine light on some of the answers. So join us for The Answers Project.
Available wherever you get your podcasts.
Welcome back to The Agenda. I've been asking our panel of guests about the continuing vaccine dispute between the UK and the EU, and joining us for the second half of this discussion is the UK Director of the European Centre for International Political Economy, David Hennig. Now, the UK's Health Secretary, Matt Hancock, has said in December the UK's vaccine success was a result of Britain's departure from the EU. But this claim hasn't so far been supported by Downing Street or the medical regulator. So David Hennig, you're an expert on Brexit. What do you think? How relevant was Brexit to this vaccine rift?
Well, Brexit is going to be a backdrop for all UK-EU trade and political relations. From a trade point of view, you have vaccines and their ingredients as part of huge supply chains going between the UK and the EU. So you can't simplify and say that, you know, we've managed to make all our own vaccines. Clearly, there have been big supply chains. Some of our vaccines have come from the EU. It's not always entirely clear why the UK has done so well, but it is quite clear to me that the UK has done better than the EU in organising vaccines. And it is very interesting that I think the EU has responded badly to that. I think that they don't like it, but I'm not sure that either the UK or the EU quite know why that has happened in that way.
And Pieter Cleppe, would the cynic say if it wasn't vaccines, it would be something else post-Brexit?
Well, there's two things I think that distinguish the UK from the EU. First of all, the UK did not take part in the joint EU27 negotiations with big pharma companies. And secondly, the UK also, when it was still bound by EU law at the end of December, they opted for an exception procedure that would allow them to approve the Pfizer vaccine much more quickly than the EU. Now, both things in theory could have happened with the UK still being a member state of the EU, but I think it's fair to say that politically the pressure would have been much more strong for the UK not to do that and to follow the EU, and thereby, especially when it comes to the vaccine procurement, also ending up in the place where EU countries are today, which is they do not get enough vaccines.
And Professor Young, the EU and UK have come to blows over vaccine rollouts, but generally is Europe and Great Britain in accord on medical and scientific issues?
Yeah, I think there's still a enormous amount of cooperation and engagement. Certainly, even personally, I have a lot of interaction with colleagues across Europe. I don't think any of this wrangle is getting in the way of that cooperation, but clearly there's a lot of frustration.
And David Hennig, Hungary, Poland, Slovakia, Czech Republic, they've all either bought or are looking at potentially other vaccines, the Russian vaccine Sputnik, Chinese vaccines. These are yet to be approved by the EU, aren't they? And how long could it take for them to approve them?
What I think we're seeing across Europe, and I think this we'd be seeing it in any country that's not doing so well in vaccinations, is a degree of a panicked response. I think that the EU's response has been somewhat less than sure-footed since January, when they first threatened export bans, and it's even and it's continued now, even though on EU forecasts they're actually going to have a significant number of vaccines arriving in the next 3 months, and they're hoping, I think the forecast is for 70% of EU citizens to be vaccinated by before summer. So I do think a lot of this still coming down to the EU just struggling to cope with something that is not apparently going their way, and I think it does raise questions about the leadership in the European Commission. It's gone against them, and I don't think they've responded very well. And individual member states as well. You're seeing a certain amount of panic. So I don't think that bodes very well for the EU's. The way the EU is run, particularly if this is what happens because the UK has done a bit better.
And Professor Young, has the UK done better because it's smaller than the bloc, the EU bloc, and it can move faster?
I think it's done better for several reasons. I mean, obviously, aside from the fact that the establishment of the vaccine task force and the procurement of more than 350 million doses of different vaccines took place through those contractual negotiations, that went well. We learned a very tough lesson through our test and trace system last year and how important it is to mobilize our national health system. And so I think the great success story here is that mobilization of the local, regional, national health service to deliver vaccinations. And that's worked amazingly well, supported, I have to say, by incredible people volunteering. And that's what's led to the situation we have today, where over 95% of folks over the age of 60 now are vaccinated in the UK.
Heaven forbid there is, Professor Young, another pandemic, anything like this. If there was something in the near future, are we better prepared, better ready for a pandemic of this scale?
I think this has been a horrible wake-up call for all of us about pandemics. I mean, we know that parts of the world are familiar with this and actually responded much more quickly, particularly Southeast Asia. We've all learned a lesson. We're going through an interesting situation in the UK at the moment. As of today, we have a new Institute for Health Protection this was on the cards anyway, but it's been fast-tracked. So a slightly different approach to public health. We, like many countries, had perhaps underinvested in public health and public health infrastructure. And I think this is going to change quite markedly now, along with a much better sort of engagement across the NHS, academia and industry, that collaborative interaction that's so important. I think we've learned lots of lessons for the future, and I'm sure we're going to be much, much better prepared.
David Hennig, we've seen perhaps some examples of vaccine nationalism. Does that extend to trade protectionism as well, post-Brexit?
Trade protectionism is rising globally at the moment, and that includes the UK, it includes the EU, and I think that is going to continue. I think that what we're seeing is that many countries are saying, why are we importing so much? We're vulnerable. We need to build more resilience into our networks. It's not entirely clear to me. In fact, I think the opposite. I think that they will actually be reducing their resilience in case of future crises by putting up trade barriers, But at the moment, the trend is very much towards trade barriers, and I think we can expect this to continue. And it doesn't help when the European Commission threatens to put up barriers. But equally, the UK is not innocent. We also have export barriers on various drugs as well. So I'm afraid this is the direction we're going in, and I really would like to see more efforts between the UK, the EU, the US, and others to try to prevent that happening.
Can you see, Pieter Cleppe, a new body being formed by the European Union to deal with crises like this, so the EU can move faster and together as a bloc?
I don't think we need more bureaucracies. I mean, national administrations are well fit. It's of course a great thing to work together in a crisis, but I think it has to happen bottom up. Also, this talk of sort of strategic reserves and repatriating production capacity. I mean, I'm based in Belgium. I'm from Belgium. This is, let's say, the world's vaccine center, but still, even UK export restrictions could bring the production of certain vaccines, like the Pfizer vaccine, to a halt. So that's the best, illustration that how hard it is to no longer be dependent of other countries. So ultimately, the best, as David also said, the best defense is that you don't have trade barriers, and the best contribution that the EU can deliver at this very moment is to throw overboard all this vaccine export restrictions.
And David Hennig, do you think the EU has lost some of its credibility because of the way it's handled the distribution of vaccines in this pandemic?
Well, I think in terms of trade and in terms of political governance, credibility ebbs and flows. There are always mistakes and there are always
but this is
good,
a pretty big
moments.
Mistake that's costing people's lives, isn't it?
Well, I think that if in 3 months' time a substantial percentage of EU citizens are vaccinated, then I think that over time that is no longer quite seen as badly. If on the other hand that isn't the case, and if you go into summer with restrictions still in place, then I think the loss of credibility is greater. But I think we overdo, and particularly in the UK, people overdo the loss of credibility of the EU. If you heard various commentators in the EU, in the UK, sorry, the EU is always losing credibility. But I think that the EU will bounce back from this. But what we can hope is that it does the right things. It's certainly a setback to bounce back from. I don't think it's a huge loss of credibility.
All right.
Yet.
Well, yet. All right, Professor Young and David Hennig and Pieter Cleppe, thank you all, gentlemen, very much, as we've been looking at the vaccine rift here on the agenda. From the start, there was no doubt that only the best science was going to provide a fast route to safety out of the COVID-19 pandemic. But the researchers, the mathematicians, the scientists working around the clock did just that and came up with the vaccines needed to save lives, and all in record time. And then the politics kicked in. There were questions about how effective the vaccines were, and questions too about deliveries, which almost resulted in a blockade in March. But post-Brexit, there were always going to be some disputes between the EU and the UK, and over time may well be resolved. Vaccines have always been heralded as the textbook case for global cooperation, but the pandemic has sometimes shown countries in competition with each other, and that's something we all have to work on if we're going to defeat future pandemics. The UK Prime Minister and the German Chancellor have already agreed that nobody is safe until everyone is safe. They want to bring countries together and dispel the temptations of isolationism and nationalism in the spirit of solidarity and cooperation. After all, we're all facing the same pandemic with a virus that has no regard for borders. Don't forget, you can watch everything from past Agenda episodes and find additional exclusive content on our website, cgtn.com/Europe, or on our YouTube channel. And of course, you can follow us on Twitter, Facebook, Instagram, @CGTN Europe. Coming up on a future agenda, it's been 100 days since the UK stopped trading under EU rules. we'll be looking at what's changed for Europe and the UK post-Brexit. But for now, from me, Stephen Cole, and all the Agenda team here in London, it's goodbye.